Today we have Lily Johnson here, which probably most of you in the department know. She's an experienced philanthropy officer with over 15 years of experience in fundraising, mostly in women's and reproductive health. She's been the Senior Women's Health Development Director here at UW for the past 7 years, currently in our department. In her work, she makes connections with a wide array of women's health advocates, grateful patients, private foundations, and alumni. She believes in holistic engagement with external partners and prioritizes donor relationships and stewardship to inspire lasting and transformational support. So we're lucky to have her here this morning to present.
Good morning. Hello, everyone. I have no financial disclosures to report, which I have always wanted to say. Thank you for having me. I'm very grateful to have this opportunity to be here this morning. I know philanthropy is not everyone's favorite topic. However, this morning, I hope to provide insight that gives you both comfort and curiosity about medical advancement. I will be presenting both a broad stroke overview of medical advancement, as well as digging into specifics of grateful patient philanthropy, as well as caregivers' role in philanthropic programs. As Laura said, I've been your philanthropy officer for just about 6.5 years, going on 7 years. And so many of you may know me already, and some of you work with me very closely. I've loved being part of this department. It's a real honor. The goal for this presentation is to not only destigmatize some of the work that I do, but also create a really holistic understanding for healthcare providers about medical advancement. As I hope you will see this morning, rather than begging for handouts or chasing dollars, good medical advancement work serves the donors more than the institution. And it creates a connection with our work that donors themselves are actually seeking. It's a way to serve them. Additionally, I aim to introduce our residents and our learners, as well as newer faculty members, about this work and this world, and give you the background that you need. So wherever you may end up being an OBGYN, you'll have a little bit of background in medical advancement, because whether or not you like it, escaping it becomes less and less likely as the years go on. Okay, first, we're going to brush up on everyone on advancement lingo, who the players are, a little bit of background, and introduce our audiences. A good portion of our time this morning will be talking about the Grateful Patient Program here at UW School of Medicine and Public Health and UW Health, its background, its history, some very serious ethical questions that come up when we talk about patient philanthropy, successes, and the role of healthcare providers in the process. I'm just going to preface this by saying grateful patient philanthropy is not new. Some of our peer institutions have been doing this work for 30, 40 years. Of course, large cancer centers like maybe the Mayo Center, MD Anderson come to mind immediately, but we can look a lot closer to home for examples of grateful patient philanthropy. University of Michigan in Ann Arbor has a very robust program. Iowa, some fellow Heartland partners of us have extremely embedded, robust, formalized grateful patient philanthropy programs and have had remarkable success. To my knowledge, there is no longer a single leading academic medical center that is not doing grateful patient philanthropy. So it's important for us to understand it and know what we're talking about. What makes grateful patient philanthropy and medical advancement such an interesting topic for Grand Rounds, whether or not you like it, is that caregivers and doctors play a key role in this process. But what makes you special, or this department special, is that you have a dedicated philanthropy officer that will do the heavy lifting for you. Well, that's me. So you'll hear about simple ways to partner and become part of advancement. Finally, we'll wrap up by talking about a few behind-the-scenes methods that donors and supporters can get involved and give to our work. You as physicians will never need to be in these details, but in order to show you a holistic kind of overview of philanthropy, I wanted to include some of these methods of giving just for an understanding perspective. Okay, so let's set the stage and look at a really remarkable rise of philanthropy in medicine. Okay, first, welcome to Development Jargon 101. I'm just going to quickly talk about a few of the key terms that you will hear me talk about throughout this morning. And honestly, anytime you talk to me, probably you'll hear these words. Advancement, which is my field of work, is also often referred to as development. I used to be called a director of development, and I am now your advancement manager. They're pretty much the same thing. But I have always liked the word advancement more than development. We use development in corporate talk a little bit, research and development, development of products. So we're going to really lean into advancement in this talk. But when I say development, it's similar. Advancement is the overarching strategy for moving an organization forward through a comprehensive approach that includes fundraising, constituent relationships, marketing and communications, and other functions. Medical advancement is when we put those efforts specifically towards advancing medical institutions, hospitals, foundations, supporting medical research, doctor faculty. The research we can support is both bench and bedside, and direct hospital and patient support. I am your advancement manager, also known as a philanthropy officer, director of development. It is a profession in frontline fundraising, and our job, advancement manager's job, is direct, strategic, intentional relationship building to benefit campus in this case. A prospect is anyone with potential for supporting our work. Financially, of course, which we'll talk a lot about philanthropy today, but there are other ways that prospects can support us, such as volunteering, hosting events for us, sharing their story for marketing and communications purposes. All of those actions by, we'll say, an outsider fall into medical advancement. Individuals, organizations, corporations, foundations can all be prospects. The data about these people and these organizations live in a large CRM database that actually just became a new database on campus called Salesforce. It has millions of records, including all alumni in the history of UW, all donors to the university, all staff and faculty to the university, as well as the entire medical school. It's where I spend a lot of my time. Donor relations is the practice of working with a prospect to figure out exactly what motivates them, what inspires them and their family. It is the forming of intentional and compassionate relationship that makes donors feel appreciated, listened to, and like partners to us in our work. My goal is to raise large transformational gifts for our department. These often require years of strategy and donor relations with an individual. A campaign is a large-scale fundraising initiative. It recruits and highlights philanthropic opportunities. We are currently right in the middle of Wisconsin medicine. You may have seen the flags around the hospital. There's branding up in the corner of my presentation this morning. Wisconsin medicine is the first ever campaign here that unites American Family Children's Hospital, Carbone Cancer Center, UW Health in its entirety, as well as the School of Medicine and Public Health together in philanthropy. Their goal is $500 million by 2025. And so you'll be hearing a little bit more about it for the next 2 years. Women's health is a pillar of Wisconsin medicine, although that launch is now just getting underway and really going to amp up next year. So you'll see Wisconsin medicine a lot in my work, my email signature, my maybe fund or newsletters we put out, this presentation, for example. That's because really any philanthropic support through 2025 is considered part of Wisconsin medicine, and our donors are really beginning to identify with being part of this campaign. Finally, I just want to mention a university foundation. We don't have a hospital foundation. UW Foundation is the foundation for all philanthropy that I work on. Foundation is a 501c3 organization here at University of Wisconsin-Madison. It's called the University of Wisconsin Foundation and Alumni Association, and it is separate from campus. It's its own nonprofit organization. This is important because we are a public institution and we do not want the legislature or any state entity to have access to philanthropy that is given to support campus. So it's actually a pretty cool design. It allows for tax-deductible nonprofit donations to support our work. And 100% of anything that I raise or the donors give to OBGYN goes through the foundation. It also employs hundreds of advancement professionals that work to support campus. Previously myself, although now I work for the department. Okay. There are two takeaways from recent grand rounds that I feel maybe kind of hauntingly, but set the stage to talk about medical advancement this morning. First, ACOG President Dr. Verda Hicks, in her presentation recently, introduced a very harsh reality about changes in the House of Medicine. She rightfully acknowledged that over the past 30 years, medicine, which was once a three-legged stool of research, education, and clinical care, has added advocacy to become a four-legged stool. But what she further suggested was that changes in Medicare, Medicaid, and most importantly, private insurance policies, HMO carve-outs, you know what I'm talking about, have led to increased competition between healthcare systems, leading to consolidation, closures, budget concerns. And therefore, there's been a huge growing emphasis on the business aspect of a medical institution. Dr. Hicks went so far to suggest that business acumen, even advanced business degrees, have become standard requirements for especially successful physicians. Okay, I don't want to dwell too much on that reality nor debate it necessarily. I'm guessing many of you find it kind of as horrifying as I did. However, as physicians find themselves considering revenue, budgets, bottom lines, more and more, I aim to present philanthropy and advancement as, simply put, good business, and maybe one of the more appealing new sources of revenue that someone can think about. Similarly, Dr. Denise Howard observations recently in her just a couple of weeks ago in the Women's Health Symposium lecture talked about the reality that quality of care is not incentivized in our modern medical system. I'll say that again. Quality is not innately incentivized. Innovation, similar, she suggested, is also not incentivized unless it leads directly to increased productivity for the healthcare system. Well, that's also horrifying. But let's just say that our modern medical system is not properly incentivizing quality of care innovation. I can argue that philanthropy prioritizes both of those things above anything else. So we'll accept the reality that margin constraints and budgetary pressures are forcing hospitals, healthcare systems, and other medical organizations to search for new means of funding. Well, this is why philanthropy is on the rise. In raw dollars, revenue generated by philanthropy is small compared to that provided by patient care, right? Maybe someday, but currently I'm not raising the type of philanthropy that rivals what we can bill our patients. However, it is an important part of helping hospitals meet the mission. The Association for Healthcare Philanthropy, the AHP, which is an organization that I follow closely, surveys healthcare foundations annually for their report on giving. And AHP concluded that it takes approximately $75 of patient revenue to have the same net impact as $1 in charitable giving. So 75 to 1. Additionally, donors like supporting healthcare. Fidelity Charitable does a huge survey every year, their survey on donors, they call it. And in 2021 and 2022, both, they found that donors put access to basic health services as their number 2 priority in this country, only behind fighting hunger, which was number 1. To go back to the AHP, their president in their recent annual address said something that I found encouraging, although I'm biased. People in philanthropy inject a new voice into healthcare leadership. It is a voice of the people who care about the institution. I believe in philanthropy because of the relationships it builds. Foundation team members have the potential to connect people to our organizations in ways that will profoundly change the lives of their neighbors for generations to come. This makes philanthropy an excellent catalyst for social change and health equity. Of course, philanthropy also has a long history of directly accelerating medical research and its impact on closing funding gaps, improving research outcomes, and really injecting startup money in new research is unparalleled. Okay, a little more vocabulary quickly. Welcome to the advancement continuum. This is the cycle where I do all my work. Any individual or entity that I engage with as a philanthropy officer moves around clockwise around this circle, and they may enter at different points, but if we're doing our advancement work correctly, they continue to kind of go around and around for the extent of my relationship with them. Most commonly, our prospects start in the identify phase. This is where we are introduced to, discover, or actively search out new potential supporters for our work. Next, we cultivate them. This is also kind of a strange word for what is actually just relationship building. This is where I dig deeper into a relationship and learn more about a prospect. What inspires them? What are they interested in? What is meaningful to their families? Why are they agreeing to talk to me at all? I may meet them for coffee or lunch. I'll set up Zoom meetings more and more, chat on the phone. I may, over time, invite them to a grand round lecture on an issue that is important to them. Ask them to come to the hospital to meet with a researcher and learn more about research they're interested in. In this stage, I am completely at the will of the prospect. They decide how much they want to know, when they want to see us, what they're interested in, and the possibilities are endless for how someone can become engaged with our department. My goal during this phase is literally just to listen, learn, and build a portfolio of bio about someone interested in our work. Gift, obviously, is pretty understandable. This is when the prospect decides to do something to support us. Of course, they could give financially, but they also could host a fundraiser or decide to get connected to marketing and communications. They're very interested in doing something. They may make a pledge of future support. This is really where we're actually receiving advancement support from someone. And during this phase, my job is to make sure that goes smoothly, make sure they have the information they need. I'm able to honor their gift by receiving it and making sure it goes to the right place. Then I really want to call out stewardship here. To steward someone just means to thank them and to show gratitude. We're going to talk a lot about gratitude today. This is where we show our gratitude. Thanking our supporters is obviously crucial, no matter the size of the gift or no matter what they've done to help us. And we always, as a department, have a value of leading with immense and heartfelt gratitude. Dr. Hartenbach sends thank you letters to every single gift. We often, do in-person thank yous. Most importantly, we show them exactly what their support has done. We make it very clear the impact they have had and that their gift to us is not transactional, because that's the last thing we ever want anyone to think. Then, commonly, donors go right back around the wheel to cultivate their next support. If we are doing our job well, they have such pride in the impact that they are able to give to reproductive and women's health that they almost want to see what can be next. A lot of the donors I work with have been supporting this department for years, and the ones that I've met over the past 6 years are still supporting the department. It's a really wonderful, rewarding continuum they become part of. Fundraising is an important outcome of advancement work, and we'll talk mostly about philanthropy today. But advancement is bigger than just philanthropy. It's about finding common cause and building a sense of community around our mission. We can then determine how we could best advance that mission together, but it's really about serving people that care about our work. So who are these people that might care about our work? Who are our prospects that support us? There are really 4 main buckets of entities that support medical advancement and that care about medical philanthropy in general. The largest audience from medical philanthropy is always patients, without question. They know you best. You are excellent doctors, and they know it. We are not a nation leading department of OBGYN for nothing. Our clinical care is excellent, and our patients feel cared for. You save their lives, you save their babies' lives. And in turn, they are full of immense gratitude. They want to know more. They want to know how to honor you, and they want to stay involved in our work after they leave our care. That's important. We're going to keep that on the forefront of our mind. Second, I work with a ton of alumni. They know our work better than anyone. They are themselves OBGYNs. They take the skills they learned here as residents and fellows and medical students and create entire lives and careers. They have an excellent understanding of academic medicine. And I work very closely with alumni, residents, fellows, and even medical students that fell in love with OBGYN while they were here. Now, these last two buckets are a little special because we work in women's and reproductive health. We have a unique base of prospects that care about our success in the community because of our values. They follow our work and they are engaged with our mission. We'll call these donors or these prospects advocates, for lack of a better word for them. And finally, I do want to focus a little bit on foundations because this is a growing area of my work. This includes, I don't know about this clip art, both corporate foundations as well as family foundations. That's what those two icons mean. That could be industry partners such as pharmaceutical companies, big charitable arms of local industry, and family foundations, both here in Wisconsin and nationally, that prioritize reproductive health. Their giving is often called grants, although I don't want us to be confused with NIH or federal grants, because soliciting this support and cultivating support from private foundations is a much more traditional donor relations act than applying for a large federal grant. Okay, now, however, our audiences in women's health are a little unique, and they have unique challenges and benefits, and I'll just cruise through these quick. We'll go to the bad news first. When it comes to our patients, they tend to be young. They tend to be just starting their families, not necessarily thinking about philanthropy. We are in Wisconsin and not Los Angeles or Manhattan, and we serve the neediest families from across our state. However, the care we provide is uniquely life-altering, whether it be fertility successes, life-affirming gynecologic care, cancer care, of course. These are unique opportunities, I argue, for incredible gratitude, no matter the age of our patients. When it comes to our alumni, we are a small department. We only have about 300 living alumni, which is not that many. Furthermore, and don't kill the messenger, but doctors are not always known for their philanthropy. They are known for lots of other remarkable and admirable qualities, but maybe not the most philanthropic profession. You do enough, perhaps. But that said, it's probably only a small percentage. It's only a percentage of our alumni, which is already a pretty small group, that are really passionate about engaging with us in philanthropy, although we're working on them. We're working on it. But that said, ever since the 1960s, and really when Dr. Peckham made this its own department, we have been known as an incredible gynecological training program. Our alumni leave us with really honed and incredible surgical skills, which I hear about all the time from alumni. In recent decades, we have fostered incredible research backgrounds and embedded our trainees in research. And I have found that our alumni are very grateful and very proud of their training. It sets them up for great success. And they're very proud Badgers for the rest of their lives. So we got that going for us. And then I just want to mention, when it comes to both foundation and advocate donors, we are always competing with countless other nonprofits for their attention and support. We don't have the concentration of corporate wealth in Wisconsin as other areas may. And, you know, it's just, there's a lot of good nonprofits to support. You know, why would they necessarily support us? Well, I argue that in today's climate, political climate, and just climate in general, reproductive health, maternal health outcomes, and direct patient support are extremely important to funders. And I really see a lot of space for growth, continued growth in the coming years. Okay, we've made it to everyone's favorite topic, Grateful Patient Philanthropy Program. Grateful Patient Philanthropy is a growing field of medical advancement where patients are prospects. It is the largest part of my job. And for many of my old foundation colleagues, 100% of the work they do. It is a complicated realm and it leads to questions and considerations, but it's not going anywhere. So let's take a look at it together. The Grateful Patient Program is an initiative where me, advancement managers and directors of development work directly with faculty and medical staff to connect with patients and their families who are interested in giving back. As we already discussed, the medical funding model has shifted. UW Health and SMPH have become increasingly reliant on private philanthropy gifts. It is through the Grateful Patient Program that we will be able to continue to ensure the world-class institution that we love. And this is a priority for both the Dean's office and the CEO's office. It is their number one area of interest when we talk about philanthropic growth for our institution. Because patients most commonly give directly to their caregivers and the disease-specific research that they have been affected by, this is a unique opportunity for us because it helps us directly support programs and faculty here within our department. Here at UW, the Grateful Patient Program first launched in 2014, although I would argue that it really picked up speed probably 2018. And it was very much founded under the belief that giving for some patients and their families is part of the healing process. So it was set up to really honor that desire from our patients to help us because we helped them. I mean, I hear from patient donors all the time. I want to give a gift so others don't have to go through what I went through. I want to make something good come from something so horrible. I didn't even know I could specifically give to support this area of UW. However, in order for this program to work, there has to be a lot of trust in place, especially trust between me as advancement officer and patients. So therefore, I must be fully HIPAA compliant. And I also, most importantly, must have a reputation in your minds as a trusted advocate for our patients. And it's taken a long time to earn that trust, and it should. I believe I have a lot of pride in the trust that I do have with our faculty, nurses, and social workers, and it brings me great joy. Since then, here at UW, millions of dollars have been raised directly from patients, tens of thousands of gifts, and over 30 professorships and chairs across the medical school. This is a growing area, and it's a pretty serious investment by our institution. In addition to myself, so I am OBGYN, of course, there are other full-time dedicated Grateful Patient fundraisers, Department of Surgery, Transplant, 2 in the Department of Medicine, Orthopedics has someone, ophthalmology, neurosurgery, American Family, Children's Hospital / Peds has 2. So we're not alone in this work, and they're constantly hiring new Grateful Patient fundraisers into UW Foundation to do this work. I want to pause here to talk specifically about patient data and philanthropy. This comes up all the time, and it should. More and more Grateful Patient philanthropy, as I just mentioned, is happening across our institution, and many SMPH faculty are already engaged in this program. Our own faculty, many of you, have properly asked about HIPAA and patient data every step along the way, and honestly, I would be concerned if you didn't. Any use of patient data should be looked at and analyzed. And here I've on the right-hand side, I have posted the direct HIPAA section that pertains to fundraising. However, it's worth talking about me and my roles specifically because I operate on a need-to-know basis. I don't have HealthLink access, nor should I. And when a patient is grateful and they want to get more involved in our work, it is absolutely allowable for you to discuss certain things about that patient directly with me. However, what you share with me is most commonly only used to come up with timing and a method in which for me to reach out to that patient. The most valuable health information that I would ever learn from a patient, they will themselves share with me once we are engaged in meeting and talking. In 6 years of this work, I have never had a patient ever question our outreach efforts. That's not quite true for other areas of patient philanthropy. UW Health directly mails and emails fundraising to almost all patients. You may not realize that, and they can opt out of that. I feel like maybe that's where our institution hears more about, why are you fundraising from me? But we have never had that feedback from anyone that I've connected with. But I want to spend some time in this space because I will always be transparent with you, because I have my own moral quandaries, honestly, about philanthropy in general. It's maybe for a different time, but especially working with patients. And if you have pause, discomfort, or hesitation about grateful patient philanthropy, you are not alone. There is near constant discourse across medical journals, the media, and our own institution about patient philanthropy programs. Just last month, there was a big article published in the Annals of Internal Medicine titled Ethical Guidance for Physicians and Healthcare Institutions on Grateful Patient Fundraising, a position paper from the American College of Physicians. This is timely, hot off the presses. This gist of this paper surrounds the idea of physicians themselves as fundraisers, and they outline 3 specific positions that they believe should guide patient philanthropy. First, they believe that physicians should never solicit charitable donations from their patients, and I agree. That's why you have me. That's why I'm here. Furthermore, any patients or family members that are initiating conversations with about philanthropy or donations with you in the clinical setting should be directed elsewhere. And we also agree completely with that. They can always be immediately directed to me. And we'll go into more of that in the middle. The second position is around using patient info for fundraising purposes. And that's why I really wanted to dig into the HIPAA guidelines in the last slide. I will never ask you anything that isn't completely legal or covered under HIPAA guidelines. But you should never discuss a patient with a philanthropy officer if it makes you uncomfortable, period. As mentioned, often what I ask is to suggest appropriate timing for outreach, because in most of these cases, we already know that the patient is interested in getting more involved. They've already said something about wanting to know more about our work. So really, it's all about timing for me. And I don't really get into details of their patient story until they themselves share them with me. However, thirdly, they posit that participation in fundraising should never be a condition of employment, a metric for physicians at their institution, or incentivized by their healthcare employer. None of those things are true at UW, and I know of no plans. I can't promise there never will be, honestly, but I know of no plans to make them true. So as far as this particular article goes, I feel like we're in good place. But I'll quote my old bosses at UW Foundation. We welcome continued dialogue about grateful patient philanthropy. So please reach out to me. If you see something that gives you questions, if you have something on your mind about this topic, this is a rapidly evolving world. And I want to make sure that we're doing it right. The last thing I want to note quickly here on the idea of morality is something that I've been paying a lot of attention to recently, which is kind of a donor concierge program, a VIP access in medicine for donors. We do not have one of those at UW Health. More and more commonly, hospitals do, where donors can quite literally pay for access to care. I've attended several seminars on this topic. It was a big issue at our AAMC conference last year. And I'm happy to talk to any of you in more detail about this because it's pretty fascinating. It is shocking how many institutions have a concierge care program formalized. But it is with great pride here at our public institution that donors do not receive care differently from anyone else. At least not by official policy. I know maybe it happens, but there's no formal process for them to receive VIP access to our care. They cannot give specifically for that purpose. And that's really important and awesome. We do have a nurse navigator at the Carbone Cancer Center that some of you may have come in contact with, but she has to work with anyone that is referred to her, not just donors. So it's a little different. Okay, so just to review, Grateful Patient Program is a thoughtful and effective partnership to identify high-quality prospects. Once identified, we work with them just like I do any other supporter of the department, and their giving is very personal and very specific, and often very long-term. Okay, I like to think I'm a good messenger for Grateful Patient Philanthropy, but I'm not the best messenger. Our patients are. So forgive my filmmaking skills here, but allow me to introduce our special guests for the morning, which are Grateful Patients Katie, Grace, and Lee, with a special appearance by Ingrid. Together, they have raised, given, or committed almost $400,000 to the Department of OBGYN in the last 2 years alone, and they're just getting started.
Okay, Katie, thank you so much for being here today, and for agreeing to have a conversation about your role as a donor and grateful patient. We've just asked a few questions we've prepared. To start off, can you talk a little bit about what gratitude means to you?
I can. First of all, the reason why I personally have as much gratitude as I have is because I'm knocking on the doors of 7 years of survivorship for ovarian cancer grade 3C. And so that situation has made me very grateful, and gratitude to me is an appreciation, more than just saying I thank you, because I'm grateful, I'm fortunate to have had the second chance of life. I was knocking on the door of not having that chance, and the department, the gynec department, has made me be able to be fortunate enough to sit here with you and talk about gratitude and how I feel I can repay it a tiny little bit.
And how did you end up as a donor to our work?
Well, I've been through several programs, events, fundraisers, and honestly, one that you set up, Lily, was visiting Dr. Patankar's lab. And that really hit home to me when he told us that we survivors were part of his research with tissue. I thought, well, maybe I could help with money too. And so that was really what made me have the decision.
You not only have attended events and given donations, but you've become a real advocate for the department and also have considered a lasting legacy gift in your estate plans. That's such a remarkable action for you to take, and I was wondering if you just wanted to talk a little bit about your decision to do that.
It was a very easy decision. Sadly, my father passed away, and he left me a little tidbit of money. And throughout my entire life, Dad preached to me, because he's a finance guy and an investment guy, and he would preach to me, you do whatever you want to with your money, but make it reasonably personal for you. So invest your money in something you believe in, something that's personal to you, and something that will benefit others. Well, that was easy.
Be here.
Okay. Lovely. I'll go first. Okay. I'm Grace Gillis, and I'm here because of my daughter Joan, who we lost in 2020 to a full-term stillbirth. And also because of this one, who is our sweet rainbow.
And I'm Lee Budden. Grace is my sister-in-law, and I'm also here because of baby Joan and my niece Ingrid, but also the 2 losses that we had as early miscarriages before we are now expecting our rainbow baby girl.
Can you talk about what made your thought process and when you decided to give back to the department after what happened to you?
Yeah, I think for me, when you expect to have a child and then you plan for it and then it doesn't happen, there's still so much of like that maternal desire to do something, to nurture something. So it just made sense to pour that energy into something that would honor that child's memory. So it's our way of celebrating Joan and of keeping her memory alive and of taking our grief and putting all of our feelings into something important that gives it something meaningful and makes us happy after so much unhappiness. Because at the end of the day, her memory is a happy thing.
Yeah, and I think for us, learning about the Hope After Loss Clinic after the endowment was established and seeing the good work they did, and then eventually becoming patients there ourselves, made us we were really grateful and thankful for the care we received at a time that was really stressful. And just thinking of having the opportunity for other people to receive that same care really was a motivating factor for us. And I believe the Hope After Loss Clinic is a thing that needs to be spread more throughout the community, because as we've been doing work with the clinic, we found more and more that people just need to learn about it and know about it, because it's such a gem and a resource in our community.
You and your families have been so remarkable. You not only created an incredible permanent endowment in Joan's honor, but you just had a very successful fundraising event. Can you talk about your desire now over a year later to throw a party like that? It was really special.
Well, I definitely think that there's just no way to say thank you to Hope After Loss and to the people like Dr. Sharp doing the work that they are. So you hope to do something, anything that says thank you, and even, the least significant way, which it still feels like it's never going to be enough of a thank you. But we wanted to do something that was a celebration and was fun and brought people together, because I think there are events in this space that exist that, bring up so much of that tragedy and grief, which is important. And those events are just as meaningful, but we also wanted to make sure there was something in the space to celebrate. And especially, again, to say thank you, because you can never say it enough.
I think also one of the things that doing the initial fundraiser showed us was that, as much power as we might have to give as individuals, our power to collect our community together could be even stronger. And then we can have other people be champions for the Hope After Loss Clinic and really expand our own power to give back by including others.
Okay. I didn't script them, I promise, but I hope that you were listening to their incredible understanding of gratitude and their really heartfelt desire to get involved in our work. They wanted to do something. They couldn't say thank you enough. These are things that we hear more and more from our patients. And so that's why I want to talk a little bit about partnering with your advancement manager. Again, that's me. And I don't want to bury the lead, but often successful medical philanthropy is as simple as leaning into your gift officer, your director of development, and trusting them to nurture these relationships that our patients want us to have with them. I'll say it again, physicians should never be frontline fundraisers. Otherwise, I'm out of the job. But when it comes to success in raising money for you and your research and your colleagues, you can really play a critical role in this identify phase. We have thousands and thousands of patients. Of course, they're all happy and grateful and love you. But some of them, not all of them, want to get more involved. Not all of them go to this thought process of what can I do? How can I make a difference, and how can I help you? Those are the patients we're looking for. Of course, I may summon you. Some of you have already been summoned by me a lot over the years to get involved in perhaps speaking to someone about your work, or helping me thank someone that has supported something that you're involved in. But that's always really rewarding and hopefully fun. And once again, never has anything to do, you're never living in that giving area. The advisory board is a fancy philanthropy consultancy firm. And, say what you will about philanthropy consultancy firms. However, they made this nice chart that I think is really helpful. These first two lines are things that we probably hear from our patients all the time. They know you best, and they are often very grateful for your care. They are expressing gratitude. However, I want to call attention to these bottom three on the right-hand side of this table. These are the things that really suggest this desire to get more involved. Tell me about your research. I really wish there was something I could do to help. I want to help. What can I do? Listening for these cues is not something you are taught to do as physicians. That's really, I guess, this new realm of patient philanthropy is kind of training your ears to hear for these things. But these are patients telling you what they really feel in their hearts. And that is, when they say they wish they could do more, I argue that they mean it. So what happens if a patient does express this immense gratitude and this desire to get more involved in our work? Really, we're going to talk about a handoff. And I say that quite significantly because that's what it is. I need to become aware of that patient so I can figure out how to plug them into our mission. And there's lots of different ways that you can inform me of a very grateful patient that wants to get more involved. And I've you can see, you can read. There's the verbal introduction having the most impact. So let's talk about what that might look like. A verbal introduction is when you directly mention me to a patient. Let's take a look at what this might look like. Forgive these slides, they're hilarious. Okay. Oh, Dr. Hartenbach, I don't know how to thank you enough. You've changed my life. You saved my life, quite commonly. I wish there was something I could do to help you. Now, what would Dr. Hartenbach say? Well, you being healthy is gift enough for me. And she's absolutely right. That's what she should say. However, what if we suggested a slight amendum where she said, you being healthy is reward enough for me. But if you're serious about getting involved, I would like to connect you with my colleague, Lily Johnson, who can tell you about our mission and how you can help. Right? Oh my gosh, it's incredible. It's an incredible verbal introduction, Dr. Hartenbach. Of course, then she has to actually remember to tell me that she said that, which is a key part of this equation. But also, not all clinicians are comfortable with something like that. And more commonly than not, it doesn't cross your mind, right? Like you're never going to think of it. Dr. Hartenbach does think of it, but she's been practicing a really long time and she's really good at it. So more commonly, you forget about it and it dawns on you later. So then perhaps you think, oh, that's exactly what Lily was talking about when she was talking about grateful patients. So perhaps then what you do is you email me. And that's a pretty easy thing to do as well. And what might that look like? Well, you can email me and the patient and say, thank you so much for your kind words in clinic the other day. I was thinking about what you said about getting more involved. I've CC'd my colleague, Lily Johnson, who works directly with patients and their families to connect them with our mission, period. And then you never have to worry about it again because then the ball's in my court, right? That's what I mean by handoff. Perhaps clinicians are not really comfortable with either of those things, and that's fine too. You can simply email me and tell me about this patient, and then I will do outreach on my own. My email is HIPAA secure. I'm on a university email, obviously. And you can tell me about the patient and what they said to you. And hey, does this sound like gratitude? I get these emails all the time. They're incredible. Or you can go directly into Epic. This is another thing in Epic that you're so excited to do, and use HealthLink to send me the patient's information. And I put instructions here. I will say, I don't know how you don't have to get as excited as me about this, but this is an incredible electronic medical record tool that puts us very ahead of a lot of our peer institutions, because it allows you to send a referral to me without ever leaving your work you're doing. So obviously you're familiar with that little arrow in the upper right. If you go down to send message, a grateful patient referral will pop right up. What that does is it emails our director of Grateful Patient Philanthropy for the entire institution, and then she emails me and I get the referral that way. It's really slick. I've started getting some of them. I love it. We love it. I'm also very interested in other funders that are not patients that you may hear about. You're reading research papers that are funded by someone. This research was funded by someone. I'm curious, who's supporting work like yours? Who are these big family foundations that you hear from at conferences that you go to? Who are your pharmaceutical companies that are knocking down your door offering you a lot of free money? Well, that's different, but maybe there's a grant there that is possible, and let's figure it out together. So also, I want to know about them as well. And honestly, bug me whenever you want. My contact information changed for those of you that worked with me in the past when I became your advancement manager. So make notes. I will note that best practices in this realm suggests that one single advancement manager can realistically manage regular meetings with about 12 to 15 doctors. And that's about who I'm meeting with now. However, and they're spread out throughout all 5 of our clinical divisions, as well as I have quarterly meetings with many of our key researchers. But I will meet with anyone, anytime. You can email me or call me. I am also here to serve as an advisor, a philanthropic advisor. If you have something you would like to raise money for, let's figure out the feasibility of that. Let's figure out how we might raise funds for something. I'm also a founding member of a group of women's health philanthropy officers. There's not that many of us, but we're a growing group. Leading institutions from all across the country have people like me. So I'm in this very nerdy club with my counterparts at Northwestern, Duke, Mount Sinai, UC Davis, Harvard, and Stanford. And our goal is to constantly be engaging ideas around the unique world of women's health philanthropy to become more efficient, more effective. And so I can be really at the top of my game in figuring out how to raise money for this department. Okay, finally, how are we doing? Woo! I want to talk a little bit about giving vehicles. As I said, this is something you will never be expected to know, but those of you that are curious about donors giving to us and what that might look like, I just wanted to really quick show it. My goal is to make supporting us as easy as possible, and to meet donors where they are. One of the best things about UW Foundation is they have this incredible infrastructure that allows me to take any kind of gift you can think of. I mean, of course, we take checks and credit cards online, in person. People can mail us things. People do stock transfers, and we take gifts of securities. We have an entire brokerage firm at our disposal to take people's gifts. I'm pretty savvy in IRA mandatory distributions, multi-year pledges, and gifts from donor advised funds. So pretty exciting. I know everyone's excited about that. Most commonly, however, and especially when we talk about patients, gift planning is the main area that we work in. It is a bequest in their will or estate documents that designates the Department of OBGYN as a beneficiary in their estate. A lot of our grateful patients do this work, and it really allows for donors to maximize the impact they can have in a way bigger way than they could while they were giving, let's say. And we do this work all the time. We also do work with families after someone's passing in obits and honorariums and things. And I'm very savvy in all kinds of gifts from gift planning perspective too, be it life insurance policies, gifts of real estate. I mean, really, the possibilities are endless. And that's important because my goal is to always say yes to donors and how they want to support us. So I'll just close quickly by saying that my aim is to advance, and the aim of any advancement manager should really be to advance the mission. My aim is to advance the mission of this department by building a diverse and wide and ever growing and changing bench of support for our work. I'm really grateful for this opportunity every day, and I really look forward to working with you. I want to give special thanks to Dr. Hartenbach for agreeing to let me talk about philanthropy at Grand Rounds, and for Jamie for teaching me how to be a Grand Rounds presenter, and to all of you for considering advancement and for considering getting involved, but especially for valuing our donors and supporters and taking them really seriously and giving them your heart. I don't think I have much time, but thank you very much.
I'll just say I feel like I've tried to learn about this over the past couple decades, but I just learned more in an hour than in previous experiences. And I really appreciate you making it so easy for providers to understand the whole ecosystem of medical advancement. I think all of us are distressed to think that, as you said, quality of care and innovation aren't necessarily incentivized in the current healthcare marketplace. I don't even like that phrase, healthcare marketplace, because I want to emphasize the care in healthcare, but I really appreciate you making it something that we could digest and understand. And your role in our department is absolutely vital. So maybe we have time for one more question. I promise to give everybody a little break.
I feel like we often have patients who are very grateful for their care, but they don't even know that philanthropy is an option. And since I don't want to be in the position of saying, like, I recognize that you might want to do more,
right,
and feel like I'm prompting people, do you have any ideas about how we as an organization or as individuals might help inform people about their options?
Yeah, and I will say I'm constantly thinking about this. We've talked a lot about having maybe some materials in a take-home folder for new families. I do think a lot of our delivering mothers do not get UW Health mailing because their inpatient is at Meriter. So honestly, we're really losing a lot of potential there. I'm open to ideas. I feel like, and I work very closely with Meriter Foundation as well. And this is something that we're really trying to figure out how to partner with together, and maybe some kind of messaging for moms leaving, going home from the hospital or something. But it's hard, and it might be that listening, it might be figuring out, how we promote maybe a low dollar, like the diaper drive or something, just to get people on my radar. But yeah, I'm happy to talk about it anytime. I think it's a really good point.
Yeah, and I will finish up with a comment. I feel like I had to learn about philanthropy because when I took care of a patient who was from a very, very, very wealthy family in Madison, and that particular individual just dropped a $75,000 check at the cancer center. So they called me when I was running G1 oncology, like, oh, what should we do with this money? And and so I was like, okay, I got to learn about this. So it's really awkward. But one of the things that I have found helpful when you identify grateful patients is to have the conversation, not about money. It's about, your story. Sometimes patients have particular stories that are really meaningful. And would you be willing to tell your story? Would you be willing to, to talk to our group that really promotes our department? And, those kind of, the telling of your story. Are you interested in learning more about our research? I think that's another really important one. And I think we probably ought to cut it off.
Yeah,
but I just want to say thanks again.
Storytelling is a good one. And we do have marketing and communication support for telling patient stories in the OB world right now. So,
and I've asked that question a million times. Your story is really, it's really special. And would you be willing to share that? And many people say no. And a lot of people say yes.